Hello ladies, my name is Prishita and I'm a women's health physiotherapist at Kanad Hospital. As the saying goes, if you check the health of a woman, you check the health of the society. A healthy baby needs a healthy mother. So today, I'm going to show you 5 exercises, basic exercises, that you can start doing 6 weeks postpartum. Before I show you these exercises, please remember, each individual will respond differently to different exercises. If you have any underlying pain or injury, seek a specialist's help before you start doing these exercises. So the first exercise is diaphragmatic breathing. Keep one hand on your stomach and one on your chest. And as you inhale from your nose, let your belly rise like a balloon, and as you exhale from your mouth, let your belly sink in. So I repeat, when you inhale from your nose, let your belly rise, and as you exhale, let your belly sink in. Now when you're doing this, the hand on your chest should not move as much. So inhaling from your nose and exhaling from your mouth. This is your first exercise. So for the second exercise, which is called the pelvic tilts, keep both your hands on your side bones and try to pull in your lower abdomen inwards, feeling your low back into the mat. Pressing your low back into the mat, you pull in, and then you push out, arching your low back. So you pull in, feeling your low back into the mat, and then you push out, arching your low back. So this is your second exercise. Third exercise is in side lying position, which is called the pelvic floor activation. So this is the best position to start this exercise, and keeping one hand near your butt crack and focusing on your back passage. So you try and squeeze your back passage and lift it. So it's not just squeezing, it's squeeze and lift. And when you do that, you don't hold your breath. So keep breathing, keep talking while you do that, and then let it go. Remember ladies, let it go. So you squeeze and lift, and then you let it go. So this is your third exercise. So for the fourth exercise, which is your tummy tuck, I want you to get on all fours. So remember, your knee should be right under your hip and your hand should be right under your shoulder. So going in, keeping your chin in, all you have to do is pull your belly button in, squeezing all your abdominal muscles, pulling them in, holding for 5 seconds without holding your breath. So keep talking to yourself, keep counting 1, 2, 3, 4, 5, and let it go. So again, pull it in, 1, 2, 3, 4, 5, and let it go. Now remember, I am not arching my back, I am not pulling my back. All I am doing is activating my abdominals and pulling my belly button in to tuck my tummy. So for the fifth exercise, lie on your side again and keeping your hand on your hips, keeping your knee bent, keeping your feet together. All you have to do is open up your knee, making sure that you're not turning back. So keeping yourself straight, you open up your knee, hold it there for 3 seconds, and close. So you open and you close. So this is the clamshells. Now I'll give you my 5 top favorite tips to remember. Remember to stretch regularly. It is very important to stretch your muscles before and after you do any kind of workout. Second, drink enough water. Ladies, you're breastfeeding. Your body needs more and more. So remember to drink enough water. Third, good bowel movement. Make sure you're eating enough fiber, that your stomach is all clear. Constipation is not really healthy for you or the baby. Fourth, start with some light cardio activity, whether it's walking, light cycling, swimming, anything, but start with something. And the final one, the fifth one, breathe, pause, and relax whenever you can. It is important to get back to your pre-pregnant fitness levels, but remember, it is always better and advisable if you go with a graded program so that you expose your body to these new changes slowly and steadily. If you want to learn more, we have a specially designed 8-week online program called Restore Your Core that educates you and trains you with these graded exercises and how to start after 6 weeks postpartum. To know more or to register, you can check the link below.